Hi, I'm Gil Feliciano, the Drug-Free Communities Coordinator for the Coalition for Safe and Healthy Elgin. With the impending law passage here on January 1st in Illinois for the legalization of marijuana, we get a lot of questions from parents on how exactly to talk to their children about drug use. We have 4 general tips and some specific ones. First of all, talk early and talk often with your kids. The earlier you bring up the topic, the better chance you have of being your child's first resource about not using alcohol and other drugs. You can't control what they hear from other kids on social media or from TV and movies. Starting the conversation early, however, and often makes it more normal and less awkward for your child to come to you when they have questions about drugs and alcohol. Second, be comfortable and positive. Sometimes it's easier to talk about uncomfortable topics when you're doing everyday things such as driving to practice or grocery shopping or packing lunch for school tomorrow. Stay positive. Rather than lecturing your child, have an open, positive discussion about drugs and other consequences. Express your expectations. Your children want to hear your honest opinion about whether or not you think it's okay for them to use alcohol or other drugs, but they also want you to be accepting of their opinion, as it is important to express yourself. But remember that your children's beliefs will eventually become their actions, so it's important to hear them out. Expect your child to ask you how you know. Now, there's no perfect answer to this question. Most youth ask this question to judge whether or not they should trust your advice. You don't owe your children an explanation or an apology for using drugs or alcohol in the past. We typically recommend responding to that question with, well, everyone's different, and whether or not I used alcohol or other drugs doesn't mean that you do the same. I love you, and I want you to make decisions based on what is best for you. Now, tips for children ages 7 to 12. Encourage healthy celebrations at any age rather than focusing on having to wait until they're 21 and can drink alcohol to celebrate. If your child asks you a question about drugs that you don't know the answer to, be honest with them. Making up an answer just to seem informed may damage your child's trust in you. Help your children create goals for their future. Help them practice how they would say no if someone offered them drugs or alcohol. Support their overall mental and emotional well-being. Help your child find a professional counselor or therapist if they're struggling to cope with adolescent challenges. Tips for youth ages 13 to 15. The average age of youth tries alcohol or marijuana for the first time is between 14 to 15 years old. Support their schoolwork and activities they participate in. Not feeling successful at school, their favorite sport or hobby can lead to stress and insecurity, and youth at this age sometimes turn to drugs to cope. Pay attention to your own actions when you drink alcohol or use drugs in your children's presence. Get to know your child's friends and their parents. Unless a certain friend is a safety issue, let your child choose their own friends and learn from their mistakes. Don't be afraid to get help from a family therapist or counselor if there are family stressors that may increase the chances your child uses drugs or alcohol. Help them practice how they would say no if someone offered them drugs or alcohol. Tips for youth ages 16 to 20. Support their schoolwork. You can't help them with your homework, or study for a test, then let them know that you're willing to help them find somebody who can. Focus on helping them understand their own emotions and how to deal with feelings in a healthy way. During this stage of their life, they're starting to make connections about how thoughts turn into behaviors. Encourage participating in sports, art, music, after-school clubs, or other interests that will keep them busy and provide an outlet for stress and negative feelings. I hope these tips here would help you talk to your kids. Oftentimes we find kids aren't necessarily interested in just information because they have Google at their disposal. They're interested in wisdom. They're interested in hearing how you dealt with certain things and how you would respond. So feel free to express some of your own experiences with as much wisdom and discernment and age-appropriate language you can. Thank you for your time. We hope that we can serve as a resource for you in the future. Again, I'm Gil Feliciano with the Coalition for Safe and Healthy Elgin.